I would like to welcome everyone to the next part of my Community Spotlight series. My name is Dr. Jasmine Polk. I'm a pelvic floor physical therapist with Savannah Pelvic Health and Wellness. And I have with me the amazing midwife, Sara Edwards. She is a midwife that serves our community. She serves the Lowcountry and some of the surrounding areas. And of course, she's going to get into all of the details about her practice, about how she started, about what gets her excited about being a midwife. So this is going to be just a wonderful, wonderful treat. Um, Sara is not only a colleague of mine, we refer patients to each other all the time. She was also my midwife with my most recent birth. And so some of our questions may be a little bit more personal, but that's just because she was a part of my pregnancy and postpartum journey. And I truly say it would not have been the experience it was without her. So I'm so happy that she is here so that she can talk about herself. So let's get started. Sarah,
Thank you. That's such a wonderful introduction. Thank you. I appreciate that.
the first question is, could you share a bit about your journey into midwifery and what inspired you to take this path?
Absolutely. So I'll give it to you, the Cliff's Notes version. I have worked in women's health since the late 1990s. I worked for a very, very busy high-risk obstetrical practice up in Maryland, and then for several years, for over 12 years. And then I relocated to the South. When I relocated to the South, I had no idea what I wanted to do. I knew I wanted to stay in women's health, but I thought that looked like maybe going to nursing school, becoming a labor and delivery nurse, or postpartum nurse, or newborn nursery nurse. But my heart just wasn't in it. So I tried several times to go back to school for that and just was not successful. So in the winter of 2012, I was speaking with a very dear friend of my mom. She's been a family friend for years, and she's also been a doula for over 20 years, going on 30 now. And we were talking, and she's like, "So what do you want to do?" And I'm like, "I don't know. I want to stay in women's health. I don't know exactly how." So she sponsored my first doula training by Two Labor. So I became a certified doula in 2012, offering labor support, and that was going pretty well. And then in the summer of the following year, and me being the type A personality that I am, I was out seeking more education on how I can become a better doula and looking for some, education on more relaxation techniques and just holistic birth in general. Um, and then I went to a workshop who was being taught by a home birth midwife. And me coming from a hospital setting, the hospital where I worked, we were one of the busiest in the state, very, very busy practice. But coming from that to meeting a home birth midwife, I was like, wait, people do this at home on purpose? Like, this is not like oops, I woke up in labor and I just spit my baby out. This is what people do. So we started chatting, and she was looking for a new birth assistant at the time, and she was just like, "I think you'd be perfect for the job." So I was just like, I had no idea what to do. I was scared to death. Went to my first home birth with her, and I was hooked. I got bit by the bug. I was like, this is how birth is supposed to go. Mind you, this is also on the heels of having two traumatic births myself. And just thinking that was the norm. So from there, working with her as a birth assistant in the home birth arena, I met who would become my preceptor for midwifery school, as she was covering for that other midwife. And, we worked together, we clicked really, really well. Um, that was in 2014. So I started working for her as well as a birth assistant. So now I'm working for 2 to 3 different midwives as a home birth assistant. I'm doing my doula thing. And my preceptor said, you should go to midwifery school. We need more midwives and we need more midwives of color. And I was like, yeah, right. I'm not going back to school and this is fine. Like, this is my jam. This is my thing. She's like, absolutely not. Absolutely not. So I started looking into different programs. We sat down together for hours at the local Starbucks, going through different programs. She helped me fill out my application. She wrote me letters of recommendation, got into midwifery school. I started my program with the Midwives College of Utah at 2017, and completed it in December of 2021, and have been practicing solo here in the Lowcountry and Coastal Empire ever since. So my journey into midwifery was one that started from a medical perspective that kind of evolved to a holistic perspective to now I'm like, this is what I was meant to do all the whole time. It just took a little bit of couple twists and turns to get to that pathway. But it's absolutely 100% my calling. I love it. I don't consider it work. Sometimes it can be a little taxing, but I know that this is how birth is supposed to go, and that I was meant to be in this arena. So yeah.
I definitely agree. You are definitely meant to be and meant to
Oh, thank you, Dr. Jasmine.
our lives. I believe we met in, I want to say, fall of 2022,
Yes. Uh-huh.
did the Savannah birth and baby together. And
Did.
it's kind of my introduction into home birth midwives. I met you and I met Mika.
Mhm.
But before then, most of the providers that I work with had come from inside of the hospital. And it has been such a wonderful journey, really working with you guys so closely, and being able to see the difference of care.
Mhm.
So, which leads
Yeah.
next question. What is your care philosophy when it comes to supporting women through pregnancy and birth?
Oh, that's a great, great, great question. And just to give Mika a little shout out because she was my preceptor as well, and taught me everything that I know. And I'm so grateful for her. And believe it or not, she'll tell her story eventually, but she came from a hospital setting. So we both had similar backgrounds. She was actually a nurse in the hospital. I was not. I was a CNA and a patient care tech. But coming from being a nurse in the hospital and then a hospital midwife to now, has really, really shaped how I care for patients. Everything that I've learned from her has shaped the way that I care for patients. So my philosophy for care is number one, education. These mamas, education is empowerment. I believe that women need to learn how to trust in their body and their intuition. I actually teach a monthly childbirth education class, especially for my first time mamas. Um, and that's one of the things that I talk about and repeat over and over and over again. You have to trust your body, trust your baby, trust the process. My role is to provide evidence based information, to provide compassionate care and give guidance and have an unwavering presence, that makes mamas feel safe to deliver and have the birth of their choice. And all of my philosophies kind of align with the values of the women that I take care of, and then giving them that education, it just kind of sets them off on a great path and a great journey into parenthood, into mothering, into taking care of themselves, into learning how to advocate for themselves, and to learning how to advocate for their own health as well. So yeah.
Okay, wonderful, wonderful. And I can speak to your childbirth class, which this is my third baby. So I've done some childbirth classes, I've taught some
Yeah.
classes, and I will say that your class was so educational.
Oh, thank you.
Took it, I was like, gosh, I wish every mom like knew, like pregnant mom could like take this class because you
Coming soon. Coming soon. It'll be open to the public. Absolutely. Absolutely.
that's going to be so amazing. So in today's healthcare landscape, which we know there is a lot going on when it comes to healthcare, especially women's healthcare, and we look at the disparities when it comes to the mortality rates of women, especially women of color. We can get into a little bit more about that probably a little bit later. But when you look at today's health healthcare landscape, what do you think makes midwifery care so unique and so valuable?
Ooh, that is a great, great question. In my opinion, midwifery care is deeply relational. We, in a system that prioritizes efficiency over connection, midwifery brings that heart back to healthcare. You'll tend to hear me a lot, but especially because we're friends outside of this, say that there's no care in the healthcare system anymore. Everybody's a patient number. You're considered a liability. You're a diagnosis. You're not, Dr. Jasmine, you're patient number, blah, 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 that has XYZ going on, which is one thing that I love about the difference that I love about the midwifery, excuse me, model of care is that we're taught to look at the whole person and to bring compassion along with information. My visits as a home birth midwife are very, very detailed. I don't just, heartbeat, blood pressure, pee in a cup. Okay, see you in 4 weeks. I'm going over the whole person during that time. Visits are booked out about 45 minutes or so. You're not going to find that in any OB office or and some out of hospital facilities, believe it or not, will not spend that amount of time with each mama because they just can't. I get it why they don't. But for me, that is such an important and critical part of the care that I do provide. I focus on prevention, education, continuity of care, which leads to better, improved birth outcomes. So, again, looking at the whole person, providing holistic care that's not just, you know, herbal medicine or naturopathic medicine. It's that combined, but I'm also looking at your lifestyle, your diet, your moods, your stress levels, how you're sleeping. All of those things make for a cohesive, healthy pregnancy. So I feel like that's really, really important. Plus, you get to build a better foundation of trust with each of the mamas that I'm privileged to take care of, because I am spending that time with them. I am talking to them about all things that are going on in their life because it is pertinent to their health. So I believe that that's one of the major, major differences between the medical model of care and the midwifery model of care. So yeah.
Absolutely. And I love what you said when you talked about that midwifery care is relational. I
Yes.
can't tell you how many patients I have that were being taken care of by you and being delivered by you. And they would talk about like their other kids and how
Yes.
my Auntie Sarah and how
Yes.
just put the stethoscope, on the belly or listen.
Yes, absolutely. I love when the little people come and help me. But that's it. You become a part of their family and you get closer to some people than other, but that foundation, that relationship, that openness for that relationship is there, which you don't find in many providers these days, which I love about you, It's not just about, you're a great pelvic floor specialist, but I don't just look at, the billboard who has the big practice and who's the most popular. I look at overall care, your bedside manner, results, number one, because thank you for having all these babies come flying out. All these pelvic floors are intact. But that's super, super important to me when I am collaborating with providers because it's so important and it's such an essential part of the care that I give. So yeah. Yeah, and I love that.
And in collaboration is something that you do. I mean, I feel like I have so many stories about you, but even just today I had to text you because I had
Yeah.
a patient come in and her blood pressure was a little bit low. And I can usually get a hold of my providers, but not many I can get a hold of as fast as I can get a hold of Sarah when
Yeah.
I have a pregnant mama and she just wasn't feeling very well and I'm just like so I just reach out and I'm like, hey, can I speak with you for a minute? And
Mhm.
then you gave us what to do, like right then over the phone. You handle the situation. And I feel like that is like true collaborative care is when you have providers that actually know each other and they know you and and they're able to talk about you and talk about you by name. And I think that is something unique we have in the birth community in Savannah, and I'm so grateful for you.
Same. Same here. Same here. I'm grateful for you as well. You've shown up for me. I'm like, Jasmine, I got this person in labor. It's stalled out. She lives 10 minutes from you. And you're like, I'm on my way.
Keys. I'm
I'll meet you here. I'll be there soon. Now, that's not all the time for every mama. So don't y'all get like, oh, Jasmine's going to show up to my birth. No, but
just like
yeah,
you
right.
know, I love to go.
I know. I know.
So to keep going, so let's get into something kind of juicy.
Okay. Juicy, juicy.
Conceptions, because everything's on IG, everything's on TikTok. What are some myths or misconceptions that you hear about midwives or natural birth?
Woo! Let's get into it. So, there are tons of misconceptions that swing in either direction, believe it or not. The biggest thing is that one of the biggest myths is that midwives are just for crunchy people. They're just for, people who are kind of off the grid or, go against the norm or have more of a crunchy lifestyle. And I take care of a myriad of people from the crunchy to the semi crunchy to corporate to people who actually work in the medical field. I've taken care of nurses, nurse practitioners, physicians. So it's not just for the crunchy, it's for those who want the more holistic birth experience, and not just the experience, but they're doing an overhaul with their lifestyle. So the birth kind of flows into that as well. It's not for somebody who, is opposed to it. They're all medically minded, everything needs a prescription or this or that. Who don't believe in the power of nutrition supplementation. And then they want to come and try to have a home birth because it's very trendy. That's another issue now. Home birth is very, very trendy on social media. Okay. But it's not for everybody.
Beautiful.
It's beautiful. It's holistic. It's all those things. However, everybody is not about this life, okay? Because it's a lot of work. That's another misconception is that, you feel like, oh, I saw this TikTok or this Snapchat or I listened to this podcast and I can do it. Yes, you can, but you have to understand all of the work that goes into those beautiful birth videos that you see, and the transformation that you as a mother, a woman, and your family has to undergo in order to have a smooth, healthy, safe delivery, low risk, and even a healthy postpartum. One of the other major misconceptions that I would like to address is that midwives are not trained. That we just woke up one day, or we were doulas and went to 50 births and said, "Now I'm going to deliver babies." No, we have very extensive education. There's different pathways to midwifery. So, for instance, I am a certified professional midwife, which just means that I went to school through a direct entry program. My program was 7 years long. I finished it in 5.5. But like my preceptor, Mika Hall, she's a CNM. So she's a certified nurse midwife. So her education was a little bit different. She went to nursing school first and then she went to midwifery school. Regardless of the pathway, we are highly educated, highly trained, and we have the same, if not better, skill set than some of our cohorts in the maternal and women's health field. Natural birth. A lot of people have the misconception that natural birth is not painful. Like it's not going to be hard. It's not going to be tough. It's true that midwives and doulas help empower and support moms, and you can have a more controlled birth, but it's going to be the hardest thing that you ever do in your life. And what I teach all of my mamas in my childbirth class is I rather prepare you for the worst than have you thinking that I'm going to come into the house and sprinkle some ethereal magic midwifery dust and take all your pain away. And it doesn't happen like that. But we do have measures in place to help you cope with that discomfort that you're experiencing. And for me in my practice, it starts in pregnancy. So from the very beginning, I'm talking about nutrition because it makes a difference on how your body rebounds and the fuel that you have to get through that tough time during labor. All that stuff. So if you're putting junk into your body's going to peter out. Just like if you were putting water in your gas tank, you would get but so far, you know. So you got to put the good things in so you can get the good things out. Exercise is super, super important. Walking is as old as time, but it helps for so many different things. It helps build stamina for labor. It helps keep your blood pressure and blood sugar under control. It helps keep your neck, back, and hips in great alignment, help keep your baby in great alignment. So all of those things make a huge, huge difference. And again, it's making sure that we're not just looking at the birthday, we're taking care of mama all along the way. So the birthday is actually a smoother process for her. Um, I have tools that I can use, such as herbs and hydrotherapy and light touch massage and all those things that I learned in my doula training and in my midwifery training. Um, and those things can take us very, very far when it comes to the home birth setting. I like to, Mika will probably quote this when she does her interview with you, but I like to steal this quote from her, is that these babies were created in an intimate space. They should be birthed in an intimate space. So
I
that having that in mind, that's what we create in the home setting, along with all the work that you had to do up until. So again, my job is to make sure that you're well taken care of, you're at your optimal health, so that when that birthday comes, we have a smoother, healthier birth experience. So yeah, yeah.
that I love that. Yes. And one misconception that I was going to talk about
Mhm.
that you don't always mention, and that is you as well as Roxanne, Mika, you guys also do concurrent care. So
Yes,
you,
absolutely,
if I have a midwife, it means I have to have a home birth, and it does not mean that. You
absolutely not,
exceptional prenatal care in
absolutely.
home, um, with and then still at the time of going into labor, go to your local hospital.
You can absolutely, absolutely.
You and the mother to figure out what is their best route. And
Hmm.
what I would like to encourage is to all my women who are thinking about having a baby, or even if you're in the early stages of pregnancy already, and you say, okay, I don't know that I'm crunchy enough for a home birth.
Yes,
Call her, call Sarah, because there's so many things that she can do, from just like a one visit consultation, just to do it like a nutritional kind of
absolutely,
overhaul, or maybe she just needs to go over your labs with you because maybe your doctor didn't explain things and you think that there are things that should be um, worked on or could be improved, but your doctor said, ah, it's okay, you're just pregnant.
yeah,
And you just need that second opinion.
absolutely.
Sarah is the perfect resource for that.
Oh, thank you.
I've seen patients do it, and I've seen it go two ways. Where some who have called her, and then they end up switching to a home birth because they say it looks a lot better on that.
Yeah, exactly.
And some still continue with their OB. They may have lockstep visits with their
Hmm.
OB and have a beautiful birth in the hospital. So I want you guys to know that a midwife's knowledge and expertise, it will benefit everyone.
Absolutely. That's actually a great point. And just real quick, I want to touch on that and add to that as well. So, yes, that's another misconception is that you come to me and you just have to have your home birth, or you come to a midwife and you have to have their home birth. Now, there are midwives who practice a little bit differently. We all have our things that, are different in our practices, but in my coalition, we pretty much all kind of practice the same. So if you're looking for a more holistic pregnancy experience, but you're not kind of sold on an out of hospital birth, that's okay. Don't feel like you have to be confined to that. You're once you sign that contract, because we all have different packages. The whole point is for mom and baby for to have healthier maternal outcomes, maternal and fetal outcomes. period. So yeah, we can support you. You can get care with some of us. In a, we could do separate packages where you can just get all your care with the midwife, then go to the hospital to deliver. Some midwives also give care, give education about having free birthing if you want to deliver on your own, or if you're going to even a birth center, because sometimes people hear midwife and they go to a birth center and it's not as crunchy or as holistic as they think it's going to be. And I've had a lot of people transfer to me from there who are like, oh wow, I didn't know this, and I didn't have that much education, and I didn't have this, and I didn't have that, because again, they no fault of their own. They just don't have the time to be able to sit with each mama one-on-one like that. So most home birth midwives keep their practices very, very, very small. We keep our clientele very small so we don't lose that comprehensive continuity of care and the compassion that comes with that. Now, I will touch on the other side of that is if you're seeing an OB the whole pregnancy, especially if it's your first birth, and then at the end you say, you know what, I don't want to go to the hospital. I just want a midwife to deliver me. I get calls like that all the time. That is not impossible, but it's a very, very difficult transition, especially for a first time mom, or somebody who's very, very medically minded. Because just saying that I want to have a home birth, that's not, unfortunately, that's not enough. The education that we give throughout the entire pregnancy and the care that we give is vastly different. So you're more likely to run into situations, complications, preventable issues, and diagnoses that we could have tackled, 10 weeks ago, but here we are and you're due in 2 weeks. So I can't cover everything and don't know that it's truly safe. Now, we can review records, and in some cases, I've been, even when I was a student midwife, there have been some cases with my preceptor where she took people on last minute, but those are very, very special individualized cases. So my thought is, or my what I'd like to say to that is, if you're considering a home birth or a more holistic experience, reach out to your local midwives for a consultation. We all do our consultations for free. We can talk to you about that. We can also do consulting while you're seeing a physician. We do that too. Like you mentioned, if you feel something's off or you're not getting the information that you need, reach out to us. We'd be happy, happy, happy to help. So yeah, absolutely, absolutely.
So we kind of talked about like the differences between that midwifery care model and
Mhm.
the hospital model. Can you describe what a typical prenatal visit might look like?
Absolutely. So my prenatal visits, as I said before, I block off an hour for each mama. So we usually spend at least 30 to 45 minutes with each visit. And every visit, we are talking about everything from your supplements that you're taking. I ask every single visit to your sleep habits. And it's not just, oh, you getting good rest tonight? Yes, no, okay. But we go into detail what that looks like. If you're having broken sleep, how your energy levels are throughout the day. We talk about your gut health throughout that. So I'm asking all about, bowel movements and things like that. Talking about alignment. I'm watching you. I do all of my visits in your home. So I'm an in-home care provider. Some providers still do that. Some midwives still do that. Some have you come to the office. But either way, the entire visit is way more comprehensive than anything you'll see in traditional obstetrical care. We cover everything, how you're feeling mentally, physically, spiritually, sometimes, because it all plays a part in your overall health care. No, it's not blanket care when you come to the midwives. It's individualized, women centered, evidence based care. So I'm going over everything that you're telling me, the things that I'm seeing, how your labs are presenting. And it's not just okay, your iron was good, your D was low, your thyroid's a little wonky. take this and I'll see you in 4 weeks. We talk about the why and what I'm looking for and what the goals are for those clinical indications that might come up. And we break all of that down. So we spend a lot of time together. And then especially if the little people are there, I love for them to help me during the visits because it educates them as well, especially our young girls. It educates them on their options, their choices, what normal looks like, how to speak up for themselves. So I absolutely love that aspect of it too. But yeah, it's vastly, sorry, my laptop's dying, vastly different from traditional care in the sense that it's more comprehensive for the mama. Yeah. And then, of course, we do all the clinical stuff too, in
Okay.
addition to all of that. So the weight, the blood pressure, that's another thing. People think, oh, midwife just comes to your house and, hey, how's you feeling? Baby's moving okay? All right, see you later. Let's just talk about crunchy stuff.
Yeah, you take labs, you draw
I
blood.
draw labs. Absolutely. I draw your labs. I review your labs. We do weight, blood pressure. We talk about like your cardiovascular system, your endocrine system, your GI system. All of those things are integrated into each and every single visit, along with a lot of education based off of how many weeks you are and where you are in your pregnancy, what you can expect, what things are standard in the healthcare industry, in the obstetrical healthcare industry, why I do certain things, why I don't do certain things. Even our testing is a lot different because we go off of the evidence. We don't just go off of what's in a textbook, but we go off of peer-reviewed, researched articles that give us that information, and we're constantly improving on that, which is another thing I love about midwifery. You're constantly learning. Just because I graduated, sat and passed my boards, sat with my boards, passed the boards, and I'm licensed, doesn't mean okay, I stopped learning, which to no fault of their own, that you find that a lot in traditional OB. It's just like whatever they learned in school, they're going to practice that way for the next 20 or 30 years. Where midwifery care, the midwifery model of care is constantly evolving. So I love that. Yeah.
You too. That's amazing. So
Yeah.
I have another question. Uh,
Sure.
what role do you feel that pelvic floor physical therapy
Ooh.
uh, plays in your care recommendations, if any?
Oh, oh, as you know, I am a huge proponent for three things: nutrition, it's nutrition and supplementation, exercise, and body work. Body work, body work, body work. It makes for such a smoother transition during labor and delivery, and not just during labor and delivery, throughout their entire pregnancy. So, one of the things that I say to my mamas a lot are, you can be Google educated, where you have a symptom, you Google it, they say, oh, it's normal because you're pregnant. Or yes, this happens to pregnant women. There are a lot of things that occur during pre-pregnancy, during pregnancy, and postpartum that are common but not normal. For instance, moms having hemorrhoids. I learned from you that that is a sign of pelvic floor dysfunction. Baby sitting breech or not sitting in optimal position. That's pelvic floor congestion or tightness. Moms having urinary incontinence. That's not normal. It's common during pregnancy, but it's not at all normal. So I feel like it has been a game changer for my practice, for the mamas who are delivering, who have had complicated deliveries before, moms who have had C-sections before, you working on that scar through pelvic floor therapy. And a lot of mamas are shocked when I'm referring them to you or to, another pelvic floor specialist. And they're like, oh, I can do that while I'm pregnant? I thought that was before or after.
Another myth.
And I'm just like, absolutely. And I need you to see her at least 2 or 3 times to get this baby sitting right. When they have neck, back, and hip pain, they go to the chiropractor, which is great. Chiropractics are great for putting the skeletal system in alignment, and keeping that in alignment or fixing it when it's out of alignment. And what I like to tell my mamas is pelvic floor therapy fixes what's pulling the skeletal system out of alignment. So the two work cohesively together. So it is a huge benefit to my mamas in their overall health. And like I said, the way that they deliver. And I'm going to give you a compliment because you have been, I mean, not that I haven't been singing your praises all along, But there have been births where I've been at where I've called you and I'm just like, Jasmine, this baby's not sitting right. What do I do? What do I blah blah blah? And in those the two cases that I'm thinking of, you know what I'm talking about. You actually came to the house, but that has been the case for a lot of my mamas along the way. I'm like, this baby is not sitting right. This pelvic floor is not right. You need to get to see Dr. Jasmine. And a lot of people, another misconception is that the more you work out and the stronger your pelvic floor is, the better. So I have these moms who are runners, who are dancers, who do CrossFit, Orange Theory, HIIT workouts, and that actually can cause some pelvic floor dysfunction. Your pelvic floor being tight as a drum is not okay for labor. It's actually a detriment in a lot of cases. So it helps with so many different things. And I've seen such a difference in the overall outcome of my mamas in their pregnancy and their birth experience. Everything from tension to discomfort to alignment. Pelvic floor therapy is so beneficial for preventing those issues from coming up or circumventing them when they do come up. So, yeah.
Absolutely. And I love the collaborative care
Yes.
that we're able to give. It's so awesome. And speaking of that, other providers. So we know you love pelvic PT.
I do.
What about chiropractors, doulas? Are there other providers that I haven't mentioned that you feel like are very important to be on that birth team?
Absolutely. So, yes to chiropractics. Because, like I said before, the two, I believe, pelvic floor and chiropractic therapy, along with other healing modalities such as acupuncture, moxibustion, all of those things that help keep the body in great alignment are beneficial to pregnancy because they help keep the baby in great alignment. Doulas are great. They are a great support system for mamas, especially my first time mamas or even mamas with little people running around. You know, there are all different types of doulas. There are birth doulas, there are doulas who provide childcare, there are doulas who provide postpartum care. Your doula is that support system for you for birth, because as your midwife I'm not going to be there 24 hours a day the whole entire time that you are in labor, but your doula can be there and add that support, whether it's, you know, her gathering some supplies for you and your partner, or her stepping in place of your partner. That can be so beneficial. Lactation consultants, also a huge part of our birth team for breastfeeding. I'm a midwife. I know this much about breastfeeding, this much about delivering babies and pregnancy. So I kind of delegate those things out that are not my specialty. So when it comes to pelvic floor issues, I'm sending you to the pelvic floor specialist. If you're having chiropractic issues or issues that a chiropractor needs to address, I'm sending them there because these are you guys' specialty. Breastfeeding, I'm sending you to the IBCLC that I work with and collaborate with. I'm giving you a doula if you need that added support. Um, all of those things make for cohesive care. Craniosacral therapy as well, for babies after they're born. I have a great craniosacral therapist that I refer to, because sometimes babies not always need a revision, but sometimes they have some tightness in their jaw, in their neck, in their back. Chiropractic can fix that. Craniosacral therapy can fix that. So absolutely, I feel like having all of those different practitioners in place that I can collaborate with makes for a wonderful and a cohesive birth experience for mama. Yeah.
I love that. I love that. So I'm
Mhm.
going to go ahead and start wrapping things up so it doesn't
Okay.
take up too much of your time and doesn't get too long. But we have already decided, so I'll go ahead and let everybody know that we will be having a part two.
We sure will.
So many more about different myths, misconceptions, just what it's like to be under midwifery care. You guys are going to get to hear my birth story, and
Yay. Love that.
that's an amazing, amazing role in our life. So to wrap up this segment, how can people connect with you and learn more about your services?
Okay, so you can reach out to me on my website, www.lowcountrymidwifery.com, or you can follow me on my social media. On Instagram, I'm loco underscore midwife, LOWCO underscore midwife.
You have
Um, I'm sorry?
great content.
Oh, thank you. I'm working on posting more. But I'm a whole midwife. I don't have time for that. I'm trying. I'm trying. Or Facebook as well, Sarah Edwards CPM. You can reach me there. But yes, absolutely. Feel free to reach out to me anytime. I'd love to connect, answer any questions you guys have. And like I said, consultations are free. All it takes is an email or a phone call or a message, and I can help guide you and help you navigate any questions that you might have about midwifery and home birth care. I'd be happy to.
Okay, that is so wonderful. Thank you so much, Sarah.
Thank you, Dr. Jasmine. This is great. Thank you for your time.
Busy. You're always catching babies, so I thank you for uh coming to hang
Absolutely.
with. Oh,
Absolutely. Looking forward to part two.
yes, part two is gonna be awesome.
Yes.
Bye bye.
All right. Take care, everybody. Thank you, Jasmine. Bye.